So welcome everyone. We are very pleased to welcome you today for this next edition of Web Biomat. And I'm also pleased to be hosting today's session. So today we are going to listen to the presentation of the INSERM unit BIOTIS in Bordeaux. First by Dr. Nicolas L'Heureux that will present the lab, and then an application of one particular person, Ghannaa, that will present her work.
Okay, well, good afternoon, everyone, and I'm happy to be here to give you an overview of what we do at BIOTIS and how we do it. So in the vast field of bioengineering, there's the subfield of regenerative medicine, which is, of course, of special interest at INSERM, since its goal is to develop new therapies. And this can be achieved through the use of cells directly, the use of various scaffolds made of various biomaterials, or the combination of the two. And through process we call fabrication, biofabrication, we can generate models to better understand the diseases or implants to actually treat them. So at the lab, we really ask three basic questions. How do cells respond to their microenvironment? How can cells be organized into tissues? And how can we create innovative therapies from the knowledge that comes from these two endeavors? So we go from cells to tissue towards organs, and we do studies that ask basic science questions, develop models in vitro, and try to reach in vivo clinical applications. So this is a research that is multi-scale and translational. One of the buzzwords we haven't used is, of course, multidisciplinary, which is probably the field that is most multidisciplinary, because to go from concept to therapy, yes, we need to understand how cells interact with their environment, but we need to understand how cells interact and communicate together, how cells interact with their substrate, how to make these substrate in 3D with biomaterial, how to biofabricate tissues and models using various methods, including 3D printing or bioprinting. And then we need to measure and understand the mechanical properties of these constructs. And if these constructs have any kind of significant volume, they need to be vascularized to survive in vivo. And that brings us to understanding the remodeling that happens once you implant those. And this remodeling happens because of what we call inflammation and immunity. Most of these studies are done through animal models of various sizes. And of course, all of this needs to respond to a clinical need. And all of this needs to be done within the regulatory framework of your country or institution. So as you can see, this is very multidisciplinary. And one of the key things for success is to break down the barriers between these various specialties. That's why we have biologists, we have chemists, we have physicists, we have materials people, we have people working with animal models, we have many clinicians, investigators from various specialties, we have immunologists, and we have people focused on regulatory and quality processes. And another way to break down these barriers is to have an organ or agnostic vision. And what we mean by that is that instead of saying, oh, we work on blood vessel, so we can't work on this subject, we don't limit ourselves this way. We find our communality around the technology and the strategy. And by doing this, we maximize the application of our technology through collaboration if we don't have the knowledge about the pathology we're trying to address. And the same thing in terms of more practical aspects of money, that allows us to seize funding and publication opportunity. Again, if we're not restricting ourselves to specific subject matter. Same thing for recruiting. if we want to recruit somebody who's talented, doesn't matter what kind of tissues they're working on, we can include them in our development efforts. That's why today in the lab, we are working on, of course, bone and blood vessels, which are historically our specialties, but also gingiva, heart valve, microvasculature, urogenital tissue repair, kidney, various forms of tumors, neural tissues, cardiac muscle, dental implant and tooth regeneration, skin, inner ear repair, intervertebral disc repair, esophagus and tracheal repairs. So BIOTIS is embedded at the University of Bordeaux. We are located in the medical campus of the university near the biggest hospital of the city. We are lucky to be in a brand new building. We're on the 5th floor right there. My office is at the corner right there. Hello. We are a medium-sized unit, about 16 members. We have, of course, full-time researchers, many clinician investigator, university professors. We have currently about 550 meters squared of labs, about 300 meters squared of offices. And we work as a mono-equipe and based on plateau technique. And so this way the labs are focused on an activity, not a group, not a person. And that allows, again, to break down these barriers between specialty, between projects, so that everybody can access the different technologies that they think is best to develop their projects. And by the way, we have members retiring, so we are actively recruiting new researchers to fill in the gap. So in practical terms, we have about 40 contracts, a little bit more than 40 contracts ongoing for about 6 million euros. These include European projects, international projects, ERC, ANR, FMR, and other foundation funding projects, regional funding and industry. And to give you an idea, last year, our research, only the research budget was 2.8 million euros. So our first key technology, we have 3 of them, is really cell culture. Now, everybody does tissue culture, cell culture, but we don't do this as a tool like a lot of labs do. This is really one of our basic knowledge base. And we do things like, for example, culture 6 months in the same container without antibiotics. We do systematic mycoplasma testing of all cell lines in our lab. So we have a very high level of quality that allows us to develop a deep understanding and expertise in cell culture. And we have expertise in human, in animal, and we go all the way from embryonic to adult cells. We have cells that we need to use right off extraction, other cells that are immortal cell lines. We do mesenchymal, epithelial, neuronal, stem cells, iPS cells. We use genetically modified and we genetically modify cells. So that's a lot of our activity. And that's why we have 7 culture labs in our unit, because we use also a lot of other technologies that are based on tissue culture, one of which that I will talk about is bioprinting. But we also do very long-term culture, which is the basis of our third key technology that we'll talk about. We do live imaging, we do hypoxia cultures, we do bioreactors, microperfusion, laser ablation, et cetera, et cetera. That's why we need so much culture space. So our first key technology, bioprinting. BIOTIS has been a pioneer in laser-assisted bioprinting. Before I arrived in the lab in 2014, there was a spin-off of a company that many of you probably know, BIOTIS, which has been the leader in laser bioprinting for 10 years. And so at the lab, we have 3 printers that use this technology. from the first prototype all the way to the most recent product that has a mechanical arm like this one and actually can print using other technologies. So a multimodal printing strategy, we call that. And in 2017, the INSERM asked us to develop what they called an accélérateur de recherche technologique, ART, on bioprinting. We call bioprint. And the mission of accélérateur of ARTs is to accelerate the use of a technology within INSERM by providing expertise and equipment, and in our case, ink development expertise also, so that people don't have to reinvent the wheel if they want to use this technology. They can come meet us, and we can train or co-develop products with them. So this is a very active part of our unit. We have about 10 projects with other INSERM's units and within our INSERM unit. And in addition to that, we have 5 international collaboration going on. So laser printing is not the only printing we do. We have a whole array of printers, some of which are shown here, that allow us to do also various types of ink printing, inkjet printing, stereolithography, extrusion printing in various ways. And as I said, we can combine these methods to do multimodal printing because the laser is the most precise but the least volumetric method, while extrusion allows large volume to be printed, but is of course much less precise. So depending on what the project is, we can offer or use the technology or a set of technology to achieve the goals. We also use, for example, laser printing for in vivo bioprinting, which is a very exciting technology. And we do a lot of other 3D printing without cells and other 3D automated biofabrication method like FDM, SLA, laser ablation. Another key technology in the lab is the one I brought 10 years ago called Cell Assembled Extracellular Matrix, or CAM for short. We definitely are among the world leaders in CAM development. For those who don't know the technology, it's based on using cells in long-term culture, mesenchymal type cells like fibroblasts. They will secrete in the right environment a lot of extracellular matrix that will assemble in a sheet. And at the end of the process, you've got a really nice material to work with. And they can be produced in large quantity and large sizes. And they are not chemically modified in any way. And they're really offering a native-like structure. And for that reason, they provide real tissue integration once implanted. They have a very long time residence in vivo with very slow remodeling. And they provide tissue-level mechanical strength. As you can see, this is one sheet of metal of material supporting 500 grams of metal. So with this technology, we've built a platform, and we can use the sheet as such by rolling it. We can make tubes, we can stack them, we can cut them, we can do all kinds of origami tissue engineering. Or we can cut them in strips, which will be threads that we can use as suture material. We can use also textile approaches like weaving, knitting, braiding to create tissues of all kinds of mechanical properties and sizes and shapes. And finally, we can use particles, very small sheets that now become injectable, opening the door to minimally invasive strategies. Oops. So these are the 3 basic technology we use, and I'm going to finish by giving a little overview of the work of 2 of our youngest chargés de recherche. And I'm going to start with Florian Alonso, who's been working for many years with Elisabeth Genot. And Florian was recruited 2 years ago. And Florian has discovered that fibrillin, a protein that's been known for a long time to be part of elastic fibers and the extracellular matrix, also has a role in angiogenesis. And that was very surprising. And this was developed in vivo, discovered in vivo in a mouse model. As you can see here, when there's angiogenesis at the tip of the invasion, there's fibrillin, and you can see that the tip cells are covered with fibrillin. And Florian has been using our various models and ability to biofabricate constructs to first determine that this also happens with human cells, but also to see if we can't use it as a method to either stimulate tissue engineering or as a therapeutic. And he's discovered that some fragments of fibrillin actually stimulate angiogenesis, which would be a great way to stimulate wound healing. And he's using technology like organ on a chip to study this phenomenon. So our most recent chargé de recherche, which just is still in the preparatory phase in theory, has been working with me for a long time. And he's working on pediatric heart valve repair strategies, one of which is for the repair of pulmonary arteries in congenital heart defect of patients, of young patients, where the pulmonary artery is too small to allow correct blood flow. So we split it open. And by doing that, we damage the valve by cutting one of the small piece of the valvule. Now we can put a patch of glutaraldehyde fixed bovine tissue to keep this new pulmonary opening open, but that does not repair the valve inside. And if you try to repair it with glutaraldehyde fixed bovine tissue, it really doesn't work really well, and this material doesn't grow with the patient. So Fabien's been developing first in vitro with a collaboration at the MIT, a strategy in artificially beating heart to repair this material with our material, the valve. But here at the Lyric IHU with François Auberti, he's using ovine cam, so cam made by ovine cells, to actually repair the heart of sheep. And we have multi-month studies going on showing that the leaflet of the repaired heart valve, I'm hoping the video is working on your side, is opening and closing. And so that's a very exciting project. And I'm gonna finish also by underlining the fact that we are really interested in supporting translation towards the clinic, which means translation toward the industry. And as an example, the lab has been supporting research effort through a company called Siltis, who's trying to develop a polysaccharide-based implant for bone repair for many years. And they went all the way to getting clinical approval for first-in-man studies. More recently, a startup was created called BioValve Therapeutic to develop stented heart valves based on CAM for the treatment, this time of adults. And that was recognized by a iLab award and other BPI France financing. So we have also another startup that's this time more in an incubation phase, being at the incubator of the SAT, local SAT here, Aquitaine Sciences Transfer. Has received an IPHD award, is also mentored by the GDR Réparer l'Humain. And Camatis has a goal of providing urogenital repair material based on CAM technology to treat things like prolapsus and effort in urinary stress incontinence urinaire d'effort, pardon. And finally, Laminaire is our most recent startup in incubation that aims to use cochlear repair, do cochlear repair by in vivo laser printer. And I was recognized by receiving a UB Booster Award recently, as did Camatis last year. So on this, I'm going to thank the entire team, many of which you may have met if you were at the ESB 2022 here in Bordeaux. And I will answer questions after the next speaker.
Yes.
Thank you very much.
Thank you, Nicolas. So just very quickly, we've already talked about it last time for those that were here, but do not forget that we have BIOMAT 2026 coming quite soon now in May in Le Croisic near Nantes. That is organized by the team of Nantes. And so you have more information on the website that is available. You can also register. So go and have a look. And also they have confirmed speakers and the program is already out. And another thing, we are also launching a new edition of the webinar. So we plan to do a Women in Science edition during March. So we have 4 webinars every Wednesday at 1. And so we have 4 amazing speakers that will come to talk about the science they are doing, but also about their personal career. So do not hesitate to join. We will advertise it on the different networks, but you already have an overview here. And also last but not least, you might be aware that we have started the YouTube channel of the association. So we are posting the webinars, at least the presentation by the PIs. So we already have 2 videos that are out, and the presentation of Nicolas L'Heureux will be added shortly. So do not hesitate to go and have a look as well. And with this, I think it's all for me. So thanks a lot, everyone, for your participation.